What worries me most is the toll that the latest resurgence has taken on our capacity to deliver health care, and the impact that that's having on our healthcare professionals, our doctors and nurses and respiratory therapists, and all the way down to EMTs and paramedics and everybody in between.
Tonight, Governor Edwards warning Louisiana about the latest threat to health care caused by the coronavirus, and also sounding that alarm tonight, the chief medical officers at Our Lady of Lourdes and Lafayette General.
All of this coming on a day where the state reported nearly 2,300 new COVID cases. Here in Lafayette Parish, continuing to outpace other Acadiana parishes, recording triple-digit totals for the second day in a row. Meanwhile, 13 of the 16 new COVID deaths come from either Acadiana or Southwest Louisiana. And that has officials at LGMC in Lourdes worried. Our Chris Welty live in Baton Rouge. And Chris, what's their message tonight?
Marcel, the chief medical officers of Lafayette General Health, as well as Our Lady of Lourdes, joined Governor Edwards during a press conference here at the state capitol. They're pleading for Acadiana and the rest of the state to help stop the spread of COVID-19.
When you're used to conducting yourself one way and we go through something like this, it is very hard for people to totally change gears and stay away from people they would normally hang out with, wear masks, keep their distance. That's just not what we normally have to do.
Dr. Amanda Logue, the chief medical officer at Lafayette General Health, says it's time to flatten the curve once and for all. She says our region is seeing a rapid increase of community spread, and following that is an increase in hospitalizations.
We work every single day, every single hour practically, to move people and shuffle them around and make sure that everybody has a safe place to stay and get care, but it is very tight right now.
LGH has had to transfer patients out of area to Rapides Parish and other parts of the state. The LGH main campus has half of its ICU and 1/3 of non-ICU patients fighting COVID-19.
We have our normal volume of patients that we always take care of in Acadiana, layered with a large volume of patients that are suffering from COVID-19. And there's just not enough room for all of that to happen at one place.
As for Our Lady of Lourdes, Dr. Henry Kaufman says Lourdes has seen a 300% increase in cases from what they saw during the initial wave of COVID-19 in Acadiana.
There are ways of flexing up our beds, flexing up our capacity. The problem is all of those mechanisms that we've put in place are being used right now.
Kaufman says the surge in patients has significantly affected hospital operations and that they have almost completely eliminated elective surgeries at the hospital over the last 2 weeks.
Elective surgeries might be a cancer operation, it might be a heart bypass, it might be a heart catheterization, it might be getting a pacemaker. These are real surgeries that have a significant impact on an individual's health. We don't see an end in sight right now, and you can only delay some of these things so long until they begin to have a negative impact on the patient.
Both LGH and Lourdes noted their staff is doing a great job, but they did note that they are beginning to burn out. They say that the rate that they're going is not sustainable. I asked if it's possible for the hospitals to recruit from out of state to bring in some help into the Acadiana region. They said quite simply, the whole nation is dealing with this pandemic and they're looking at all avenues. Live in Baton Rouge, Chris Welty, KATC TV3.